I think it's many of the areas that have been struggling with an overdose crisis really since the 70s and before, without it abating a whole lot. So, the South Bronx, Brooklyn, East Harlem, Washington Heights have all consistently been struggling. And for a long time, the only response that came from a public policy perspective was incarceration and criminalization. And now that there's been a shift in tone and a shift in rhetoric with the changing demographics or the perception of change with the opioid crisis, some of that is shifting a little bit, but there still aren't the resources going to those communities that are really necessary, and culturally responsive treatment programs, peer-based treatment programs that really make sure that people are connecting with somebody who they can relate with, but really rooting it in harm reduction overall. I think, unfortunately, so often the conversation around treatment has been really restrictive in terms of what treatment means, and trying to tell people what it should be for them, instead of listening to where people are at and meeting them there and not leaving them there, right? But making sure that the resources are available and that somebody isn't cast out of a program or cast out of treatment if they relapse or if they happen to use again. That's precisely the moment when somebody needs help and needs support, right? So really changing the framework that we're operating within from one of a kind of punitive model to a health-centered model, but then even within that, making sure that we're not taking the approach of dictating to people what should happen, but really supporting folks and keeping them healthy as they're making their journey or making their transition. And that's what harm reduction is really all about.